If I could choose only one treatment for heel pain, just one, this would be it every single time. I'm Dr. Pelto, and I've seen thousands of patients with foot problems, including plantar fasciitis and Achilles tendonitis. But here is what shocked me. This treatment I'm about to talk to you about has an 82% success rate, and it speeds up the healing by about 50%. Most doctors that I know, they are stuck using old methods that barely work. But today, I'm going to show you the game-changing technology that's transforming how I treat heel pain. By the end of this video, you're going to understand exactly why shockwave therapy works, who it's perfect for, and whether it could be a solution that you've been desperately searching for. Let me paint a picture that possibly sounds familiar. Imagine you wake up in the morning, you swing your feet out of bed, and the first step feels like you're stepping on glass. You've tried everything, including icing, stretching, anti-inflammatories, cortisone injections, physical therapy, maybe you even got custom orthotics. Some things have helped temporarily, but the pain in your heel keeps coming back. Here's the problem that most traditional treatments don't address. They're only managing your symptoms. They're not actually healing your damaged tissue. The real issue is that the area, like your plantar fascia and your Achilles tendon, they naturally, because of the tissue, the plantar fascia is white, the Achilles tendon is white. White things don't have good blood supply. And without good blood flow, your body can't deliver the healing nutrients these tissues desperately need. That's where shockwave therapy comes in. But before I explain how it works, let me tell you about Sarah, a patient who changed my perspective on the treatment with plantar fasciitis. Sarah came in dealing with heel pain for over a year. Her job was as a florist. She was standing all day on her feet, and by the end of the day, she couldn't even put weight on her right foot. And I tried to help her. I gave her 2 cortisone injections, and they helped temporarily, but the pain always came back. I did an ultrasound on her heel, and it showed that there was significant thickening in the plantar fascia. And this is a clear sign of chronic inflammation in the tissue because the tissue becomes scarred and it becomes thickened. And that's when we decided to try shockwave therapy. After 6 sessions, Sarah was 90% better. She went from limping and being unable to work properly to walking normally and standing all day without pain. But here's what really convinced me this treatment works. It wasn't just the pain relief. The follow-up ultrasound showed that the fascia had actually healed. The thickness had decreased. The tissue looked healthier. So what exactly is shockwave therapy? It's not someone hitting you with a hammer, though I get that question a lot. We use 2 types of machines in our office. There is something called the radial shockwave, and there's something called the non-radial shockwave. Both work by creating high energy waves that penetrate deep into your tissues. Inside the radial machine, there's a handpiece, and there's a small little projectile. It's basically a little metal ball that oscillates back and forth. And when this hits the metallic tip, it creates pressure waves that transfer through your skin and into the damaged tissue. Now, here's the fascinating part. And this is where most people get confused. They think the shock wave heals the tissue, but it doesn't heal it directly. Instead, it tricks your body into thinking there's a fresh injury. Your cells respond to these mechanical pressure waves by releasing chemical signals that trigger your body's natural healing response. And this creates something called angiogenesis. That means the formation of new blood vessels. Now remember before what I said, that poor blood flow was the main problem with these tissues like the plantar fascia and the Achilles tendon. While shockwave therapy, it literally stimulates new blood vessel formation into the damaged area. That means if there's blood flow, there's more oxygen, there's more nutrients, and there's faster healing. Now, the research behind this is incredible. Multiple studies show that shockwave heals the tissue faster. In my experience, it's 82% effective for plantar fasciitis, and it speeds up the healing by 50%. But it's not just for heel pain. It works for Achilles tendonitis, it works for tennis elbow, it even works for non-healing fracture and many, many other issues. What makes this even more impressive is that most of these studies that we read about in the research focus on chronic cases, people that have pain and failed traditional treatments for over 3 to 6 months. The treatment protocol is very simple. It's typically 6 sessions. I usually do them 1 week apart. Ideally, I'd like to get all 6 sessions in with an 8-week period. Now, some people, if they're in a hurry, you can do it every 72 hours. So some patients, I do it twice a week if they're in a hurry. The sessions take about 10 to 15 minutes, and we deliver energy at a frequency that your body can tolerate. What does this mean? Now, it's not going to hurt during the treatment because we start out low and we increase it. Most patients state that they have a pain on a scale of a 5 or a 6 out of 10. What I tell patients is I say, you have to tell me if we're in the green, in the yellow, or the red. What phase are we in? If it's in the red, I'm going to turn it down. So what happens is I start low and I gradually increase it as your tissues adapt. The discomfort is temporary, but the results can be permanent. And unlike cortisone injections, there's no risk of tendon rupture or tissue damage. So who is the perfect candidate for shockwave therapy? First, it's anyone with chronic heel pain or Achilles problems that haven't responded to conservative treatment for 3 to 6 months. Athletes love this treatment because there is no downtime. Unlike when you have a cortisone injection, many times we tell our patients to take it easy for about a week, but with shockwave therapy, you can return to activity immediately. I use this frequently on patients that are very active, those that are runners, triathletes, people during their build-up phase. It helps them get through those high mileage weeks when they have injury, when there's maximum stress on their body. It's also excellent for patients who can't have surgery or those that can't handle multiple cortisone injections, because cortisone injections can increase the blood sugar in people like diabetics. The treatment is completely non-invasive, but here is who it's not for. If you're looking for an instant relief or quick fix, it's not for you. Shockwave is called regenerative medicine, means your body heals itself. It needs time to heal itself. Most patients start feeling better around week 5 to week 6, with full results taking 12 to 24 weeks. Now let me walk you through what happens during the treatment. First, you come in and we position you comfortably, meaning if it's for the plantar fascia, you're going to sit. If it's for the Achilles tendon, you're going to be on your stomach. And I apply a lot of ultrasound gel so that the machine can be in contact with your skin, so these waves can penetrate through. Then I start with the radial machine, and I start to treat an area about the size of a dollar bill or your hand. And I do this around your heel or the back of your calf. I move the machine with these pressure waves all around. I do it more in the heel and a little bit less in the arch where it's more sensitive. We start very low, and then I gradually increase it based on your tolerance. So for some patients, the first session, I might do it very low, but then as we do more sessions, I'm going to increase. I typically do about 2,000 pulses with the radial device, and then I switch to the non-radial shockwave. And with the non-radial shockwave, I do more of a targeted treatment area where it's most painful. For the non-radial treatment, I just stay right in that area about the size of a quarter. And this is where we really concentrate at the insertion points of the Achilles tendon, on the insertion point of the plantar fascia, and the areas of maximal tenderness. After treatment, you're going to have a little bit of soreness for 12 to 24 hours. And this is actually normal, and it's actually a good thing because it shows that your body has started the healing process. I recommend gentle stretching and staying active, but I recommend avoiding high impact activities for a few days only if you have pain. If there's no pain, you can do it. Now let's address the elephant in the room, the cost. Unfortunately, most insurance companies don't cover shockwave therapy yet, even though the research is overwhelming. Yeah, they're going to pay for a surgery, but they're not going to pay for something that could avoid a surgery. But I have patients every single day that do shockwave. Yes, it's an out-of-pocket expense, but when you compare it to the cost of chronic pain, multiple doctor's visits, endless physical therapy sessions, and potential surgery, many patients find it's worth the investment, and if you have flex spending, you can even use that. Remember, we're talking about an 82% success rate for a condition that traditionally has been very difficult to treat. Many patients that I see are second opinions. They've seen other doctors for cortisone injections, other treatments that aren't getting better, and then they come to me for shockwave therapy. Now, this is more successful than most surgical procedures. I've had patients tell me it was the best money they ever spent because their foot pain wasn't getting better, just like Sarah, who said it completely changed her quality of life and her ability to go back to work and enjoy her life. But I want to be completely honest, it doesn't work for everyone. There's about 10 to 15% patients that don't get significant relief, or they need other treatments that we can provide. And if you've had a nerve pain, if it's caused by nerve or other systemic conditions like rheumatoid arthritis or other type of arthritises, this therapy might not be the best choice for you right now. If you've been struggling with chronic heel pain or Achilles problems and the traditional treatments haven't been effective, you might be a good candidate for this game-changing therapy. This might be what you're looking for. The key is getting properly evaluated first. We always do an x-ray and an ultrasound to confirm the diagnosis, and then we make sure you are a good candidate for treatment. I've seen this treatment transform lives. Patients who couldn't walk without pain are now working and enjoying their families. People who were considering surgery are back to their normal activities. So you might want to consider shockwave therapy. And if you found this helped you understand better, let me know. Please give this video a thumbs up on my channel. I'm here to educate you about foot problems and help you discover real solutions. Check out my other videos on plantar fasciitis treatments and Achilles tendonitis problems. And remember, you don't have to live with chronic pain. There are real solutions out there, and shockwave might just be the one that works for you. Thanks for watching, and I'll see you in the next video.